heard from my mother last night, who called me concerned and said, Governor Christie just said in an interview that you were, quote unquote, obviously ill. And this is so frustrating to me. First of all, I don't think he's a doctor. And secondly, he's never laid eyes on me. And thirdly, I have been asymptomatic since I've been here. I feel physically completely strong and emotionally completely exhausted. But for him to say I'm obviously ill, which is even a strange statement, what does that mean? Someone define that for me, because I think I don't quite understand what obviously ill means. But I am here to tell you that I am completely fine physically, and being held here is just, I just don't understand.
Before we talk to you about your return from Guinea, if you can talk about the treatment of your fellow nurse, talk about what the whole issue of how Kaci Hickox is being dealt with right now. She arrives at Newark and is taken from there, ultimately against her will, placed in 21-day quarantine. She now says she's going to sue over her treatment.
I mean, I think that it was a decision that was made that was probably not well thought out. Like everyone has been saying, there's a lot of, it was just probably, it's not a well thought out. There's no evidence that she's a risk to anybody in the whole country. So I obviously don't agree with putting her in quarantine. I think that just monitoring your health like we're told to do every day and taking your temperature every day, we can't give anybody Ebola if you don't have symptoms. She obviously doesn't have symptoms. So it was not a very well thought out or rational decision to do, and we'll see what happens.
And Carissa, could you talk to us about what happened to you when you came in the country, when you returned in your last trip from West Africa?
I mean, I just returned back last week, and I came in and I went to JFK, and they brought me into a room and they monitored my temperature, and I didn't have a temperature, so basically I just went home. And I follow the daily rules of Doctors Without Borders, where I do take my temperature every morning, and I send an email every morning to the Department of Health, and I let them know that I'm feeling fine, and so far I'm feeling fine. So I think that actually this is less of a problem, and what we're talking about expats returning and not treating them well in the United States and expats having Ebola here in the United States is not really the issue. I think the issue is much more talking about those 10,000 people who have contracted the virus over in West Africa.
Can you talk about what you found in Guinea? Talk about your time there.
I mean, there's a lot of problems in Guinea right now. I've been there, I guess the first time I went was in April, and I basically just have seen the progression get worse and worse and worse with the virus. MSF is basically reaching its capacity. Where I was in a town called Yekudu, which is where the whole outbreak began. And we ended up having nearly 100 beds in our facility. Right before I was leaving, we were discussing of what we do if we have to start turning patients away, because we were getting patients coming from very long distances away. And we were worried that we weren't going to have enough capacity to actually treat and isolate the cases. So there needs to be a lot more work and a lot more help going there to help get this under control.
And what do you think will be the impact of what's happened to Kaci Hickox on the other caregivers thinking about going to West Africa and doing their part to be able to stem the spread of Ebola?
Well, I'm hoping that not every state takes this decision, and hopefully the decision gets re-looked at, so hopefully it won't have too much of an impact. I know it wouldn't probably impact me so much going, but that's also knowing that there's plenty of other countries in the world which would be happy to have me for 21 days after I came back and would let me hang out at home and not be in a hospital. So hopefully the decision will get looked at and it won't have an impact, because it would be really unfortunate. It's unfortunate for her. She went over to Africa to help in West Africa for this Ebola crisis. There's a lot of suffering over there. There's a lot of people who are really, really scared over there. And to have her welcome back into her home, like we're welcoming her back, is not the best face of America.
How did you protect yourself? How did people in Guinea protect themselves, both in communities where people had Ebola and in the hospital where you worked?
We were using the personal protective equipment. So when we were in the center, the treatment center, we were very, very well protected. We had the jumpsuit, the yellow jumpsuit on, and masks, and 2 pairs of gloves, and hoods, and aprons, and everything that you see on TV. So we were very protected while we were inside the treatment center. Outside, the treatment center, though, is basically the passive part of a response to Ebola. And the part that's very important is the training of people in the community and doing outreach and going into the villages and speaking with a lot of people and teaching health workers. And this, we were protecting ourselves basically by keeping distance with patients or keeping distance with the population, keeping a 2-meter distance, washing your hands a lot. There was chlorine everywhere. I mean, that said, it doesn't make the risk zero, and there's plenty of health workers in Guinea who've gotten sick. But there's many precautions that certainly MSF is taking, which is keeping me, I feel, pretty confident that I don't have Ebola and that I didn't get Ebola while I was there.